Hello, everyone, and welcome to our third and final CANTALK of this webinar series. I'm Seth Mendelson. I'm the creative director of the Heads Up Concussion Advocacy Network, and I'm joined by Ryan Sutton and Logan Armstrong, and they're going to introduce themselves in a little bit. And we're really excited because in this webinar, we're going to be talking about the holistic treatment options for concussions and traumatic brain injuries. And we've got an amazing panel, and we're really excited to really break down some of these different options that you may have never heard of or even knew could benefit someone with a concussion or traumatic brain injury. And we're going to have some incredible insight and perspectives from experts in these fields. So I'm going to pass it on to my co-founder and partner, Ryan Sutton, to talk a little bit more about this webinar.
Hi, everybody. My name is Ryan Sutton. I'm the executive director of the Heads Up Concussion Advocacy Network. Really happy to be here with you all today, and really happy to also be talking about a topic that's very relevant to really anybody who's sustained a concussion, and just understanding the different treatment options that are available to you. And with this webinar, we wanted to provide some different, opinions or different perspectives on where you can go for your concussion recovery. But before we get further into that, I just want to establish this as a safe space to talk about the injury, and anybody feel free to ask questions if you have any. We ask all speakers and attendees to create an environment built upon mutual respect and sensitivity. And in any case, I will be sharing resources pretty much right after I'm talking here, if anybody gets triggered or needs to seek help immediately. So I'm going to pass this over to our events program volunteer, Logan Armstrong, to give a brief overview of what the event will entail.
Hey everyone, as Seth said, or Brian said, my name is Logan. Today, our webinar gathers many different health professionals who support and treat persons with concussions and brain injuries to speak about diverse treatment methods and holistic approaches to treatment, and to discuss the multi and interdisciplinary management required for recovery. We have 5 speakers who specialize in different fields of practice to share their knowledge and expertise on concussions and concussion recovery. Tonight, we will be concluding our webinar with a panel discussion and a Q&A period for everybody, so that way you can ask your questions. And now I'll just pass it over to Seth to give us a little more information on our raffle.
Thank you, Logan. Yes, one of the really exciting things that we've done throughout this entire series is we have 3 different prize packages. They're all in the form of raffles, and just by being here today, you get 3 tickets for a chance to win one of 3 packages that include our brand new Challenge the Stigma apparel, and we will be announcing the winners later this week. So you still have a chance to get more tickets through donations. All of the donations goes towards helping our initiative in our organization to challenge the stigma surrounding concussions and mental health, and really helps us put more events like this together. For $5, you can get 5 raffle tickets, and for $50, you can get 200 raffle tickets, and everything would really go towards helping us, grow this nonprofit. And we're really excited to have this initiative and have this little contest going. So be sure to check that out. Ryan's going to be putting the link to that in the chat as well. If you'd like to, raise your chances of potentially winning some really awesome apparel come this holiday season. And I'm going to pass it over to Ryan, who can talk a little bit about how this raffle was even made possible.
Yeah, so thanks, Seth, and thanks, Logan, for the overview. So I just want to briefly highlight our sponsor for the webinar series and for the raffle, Sokoloff Personal Injury Lawyers. They're a Toronto-based personal injury law firm that gets paid when you do. They take cases in the litigation phases and work with their clients to ensure they get compensation that they deserve. They're for more complex cases. So if you're kind of past a phase where it's the early stages of what that process would be, and you don't know where else to turn, they're definitely a good option. I will be sending links to their website in the chat. So if you want to get in touch with them and their team, I know they're pretty great and they're really passionate about the work that they do. And we're really grateful to have them as the sponsor of the event. I'm going to pass this back over to Seth, and he's going to just briefly talk about the organization and why we're so excited for the event.
Yeah, so if you've been with us for the other 2 webinars, we've touched upon very different topics. And the reason was for Logan, myself, and Ryan, we're all chatting about where we can provide the most value and how we can help people, going through recovery or still dealing with their injury. And we kind of wanted to figure out what would have helped us during our experiences. And so our first one, we actually had people, share their lived experiences, and we really looked at the individualistic nature of these injuries. Our last one focused on mental health. And now we're really excited to touch upon the holistic treatment options. And that really stemmed from talking with Logan and hearing more about her story. And I want to pass it over to her because I think when you hear it, you'll understand the importance of finding so many different approaches or the need for it when it comes to recovering our brain. So I'll pass it over to you, Logan.
Thanks, Seth. So I did sustain my most recent concussion in February of 2020 in a motor vehicle collision. Throughout the course of my recovery, which I'm still going through, I learned a lot. I learned a lot that concussion recovery isn't linear and it doesn't have a quick one-stop fix. It requires a multi and interdisciplinary approach. So I had to seek out so many different professionals, which included physiotherapists, kinesiologists, chiropractors, and concussion specialists, registered massage therapists, occupational therapists, registered social workers, psychologists, neuropsychologists, dietitians, TMJ specialists, and a somnologist, all who have played a very specific and special role in getting me to where I am in my recovery right now. And at the very beginning of my recovery, I wasn't aware of how many people would be required to be part of my circle of care, just because that information just wasn't there, and I wasn't aware of the resources that were out there to help guide me. So the purpose of this webinar today is to really help shine a light on how many different aspects there are to concussion recovery and the different modalities of treatment. So I'm really excited to have all of our 5 speakers here to help share how they can help in concussion recovery and share their expertise. Right now, I guess I'll pass it back over to Ryan, and then we can jump into having our speakers join us.
Yeah, so first and foremost, thank you, Logan, for sharing that. For somebody who's been through concussions, definitely know how hard it is to navigate through that process, whether it be trying to figure out things to do at home or just trying to figure out where to even go first. So yeah, definitely happy to be putting on this event. And as I'm speaking right now, I'm actually going to bring in our first speaker. We have Penny Welch-West with us. I'm going to promote her to a panelist right now and bring her in, and I'm going to do a brief intro. So Penny, she works as a speech language pathologist at Parkwood Institute in London, Ontario. She also works in an outpatient acquired brain injury addressing swallowing, speech language, social, cognitive communication disorders. She created and facilitates several cognitive communication groups, including an innovative return to school program to address the needs of secondary and post-secondary students resuming studies following a mild traumatic brain injury or concussion. How are you doing today, Penny? Really nice to see you again.
Yeah, thanks so much. That's a great introduction. And thank you so much, Logan, for sharing your story. I really impressed with the work you guys are doing, professionalism. Happy to be here.
Yeah, so I guess first and foremost, did I miss anything in that intro? Anything you want to add there?
I thought you did a great job. I think you had it. Yeah.
Okay,
That's perfect.
awesome.
Yeah, I just actually hopped off of some concussion guideline work that I was doing. I was on another Zoom call just prior to this one. So yeah, it's
Awesome.
perfect timing.
Yeah, so you'll be nice and ready to answer some questions here then.
I hope so. I hope so.
Awesome. So I guess the first question I have for you is, what is speech language pathology and how can it help someone during concussion recovery or brain injury recovery?
Sure. Yeah. So speech language pathologists, or SLPs, we sometimes go by that, work with individuals who have communication challenges, cognitive communication issues, social communication challenges, and sometimes disruption to swallowing function. The scope of practice of a speech pathologist includes addressing a lot of the things that people with concussion talk about. And these include difficulty with things you described, Ryan, in the intro: attention and memory, word finding challenges, difficulty formulating your thoughts or ideas, challenges with comprehension, including a slow, sometimes processing speed that I'm sure many of our listeners can kind of relate to. Reading difficulties, losing your place, not being able to remember what you read, losing your place, and rereading is a lot of what I hear. Writing concerns. I see people with issues with reasoning and problem solving, difficulty with seeing things from multiple different perspectives, or just really becoming overwhelmed with problems as they arise in their lives. And then executive function. So speech pathologists work on helping individuals with things like planning and organizing, initiating, and then the opposite of that, which is filtering. So not saying things you shouldn't say, and being able to read a context and read the environment to be appropriate, and then awareness as well. So these are the areas that I commonly hear about from patients in my practice, and these areas can really be barriers to successful return to work, return to school, return to life, and we think of those things as earn and learn and play. We work with individuals as well to return them to function through that communication, cognitive communication, social communication, and sometimes swallowing lens.
Well, thank you for that great overview. Yeah, I guess, yeah, so it's very open and well encompassing. There's so many different facets to it, right? So it's not necessarily just the speech, it's also the processing, and there's a lot of different things involved with that. That's awesome. So I guess next question I have for you is, during what phase of the recovery would somebody typically come and see you?
Yeah, so it's not to say that we wouldn't see patients in the acute phase of recovery, but for myself and most speech language pathologists, we more often become involved with patients when they're in that persistent phase of recovery. It's important to stress that most individuals who experience a concussion have these recovery trajectories that are pretty straightforward. And fortunately, 80% of people have this uncomplicated course. Those are not the people that I see, unfortunately. Our team of occupational therapists, physiotherapists, social workers, nurses, and physiatry team, we see the 15 to 20% of folks who have this persistent post-concussion set of symptoms. And I think that people with concussion need an interdisciplinary team approach. No one discipline, as Logan was just describing in the introduction, can fix this and can fix concussion. And I don't think they should claim to do so. I think you need a team. I do participate, as I was mentioning, in provincial treatment guidelines, my own discipline's position paper on concussion care, as well as working with who can call themselves a concussion clinic. And this is important so we can make sure that patients get access to the services that they need for whole person recovery, which is something you guys are talking about tonight. I'm going to be honest, sometimes it's really difficult for patients to navigate their way to me. They may not know the questions to ask. They may not be asked by their providers the right kinds of questions that would steer them to know that I am the discipline that they need for cognitive communication or the swallowing challenges that they're experiencing. So it's really important that patients are not referred only to what their health provider may be familiar with, because if they're not commonly treating people with concussion, they may not immediately think of the discipline like mine in speech language pathology. We know that, for example, concussion is not just a physical injury. And I think Logan, her team of people and the list she's provided suggests that was her experience and my experience in talking with so many. You need to ask patients questions about cognition, communication, physical changes, and coping. And so that way that they can make their way to the disciplines that can best support that. And that referral gets along to disciplines like mine and others who support this great work.
Well, thank you so much for that. Yeah, that's definitely a lot of information for sure. So I'm just looking here in the Q&A. We actually have May, who's one of our other volunteers as well. She first and foremost just asked us to slow down a little bit, a lot for her to process right now, and I'm sure other people may be feeling that. So maybe we'll slow down the tempo a tiny bit there. And then another question she has is, what is considered the acute phase, and how can one register for that for your program?
Okay, that's kind of two questions. So the acute phases, right after injury and people are presenting to emerge, or their family doctors within maybe a day or so of the injury. Again, we expect people to recover fairly nicely in those first couple of weeks. The phase that I'm more often seeing people, or the persistent phase, we think of as being out past 4 weeks of time. And so that's typically where you'll see a lot of the allied health starting to become more involved. And it's certainly physicians and nurse practitioners and others still managing that acute piece of it and the medical pieces of this. But I would say that's the distinction as per some of the guidelines that we have now. It's about that 4-week mark. The second part of the question was around access to my program. And so I work at Parkwood Institute in London, Ontario, which is part of St. Joseph's Healthcare. We do require a physician referral, a nurse practitioner referral to our program. And at that time, there would be a triage appointment. So typically our nurses who do the triage would call out and process referrals that way. And if it's determined that you are a student who is in need of supports, I do have a requirement that students are active in their pursuits of school, not sort of have a dream of returning, but they're imminently returning to school to get into the program. So the form, I believe, and I didn't prepare for this question as I might have, there is a form, I believe, on Parkwood Institute on the website. And it's likely under concussion, I would think.
Okay, well, we'll try and look at that. I'll try and look it up actually once I'm done, I guess, speaking. Or I guess Seth may be looking it up right now, and we'll see if we can get it in the chat there for everybody.
Great, thanks, guys.
Yeah, no problem at all. Happy to do it, honestly. So then I guess another one is like, what sort of benefits would patients see from coming to see you? You touched upon like certain things you work with them with, but I guess some success stories or what's it like working with someone in the phases that you do?
So like the process of helping someone, you mean?
Yeah.
Yeah. So it usually begins with the process of formal and informal assessment tools. We like to get an understanding of how the individual views the changes in their cognitive communication skill set. So what's different? We may not be able to fix all the things that give you difficulty. We're looking for things that are related to the concussion and that have changed since the injury. We have patients complete self-ratings. We also ask loved ones and close others to complete some of those same self-ratings about patients too, so we can get a more fulsome picture of what's happening. Sometimes you can imagine that you may not be aware of the difficulties you're having, but someone close to you is flagging that or indicating it in a different degree of concern than you might be. That speaks a little bit to some of the insight issues that some folks experience. After I complete the self-ratings with patients and their families or close others, I typically ask a question that is, what is one thing that I could change for you, have stop or start or help you accomplish? And this is a really important question because it helps to hyper focus what is the currency for that individual. So what is the most important thing to you? And as Logan described her story, I bet there were a few things that you thought of right away that you wanted to really get some help with or get some help around. And it may not always be something that I can help address, but I work with a team of people, and that's important. Rest assured, I always give people another chance to give me a second or third goal that they have as a priority. And that helps us to sort of set what is, again, the currency and also the sequence of how we're going to work. We often complete formal assessments in those areas I talked about at the beginning, and that Ryan, you so eloquently described, in attention and memory and problem solving, reading and writing, social communication. And these will be selected based on the patient's input, what they feel the important things are to target, the needs of the patient, what are they doing at home, what are they going to do at school, what are they doing at work, and also the clinician's experience in concussion. Some clinicians have preferred materials they like to use, so it could look a little bit different depending on who you went to see. We also complete task and job analysis to really understand what is a day in the life of that person. Again, back to school, job, and vocation, and what the requirements are of those things. So we've been talking a few times about my return to school program. So I do facilitate that. And this provides a very targeted treatment, and it does so in a simulated classroom. And I think it's really important that we practice the skills in the settings that we're going to be using them. And that's something that speech language pathologists are really known for doing, along with our colleagues in occupational therapy. One of the things about my return to school program is that I think is really important is it has a significant element of peer support built right in. And I think all of you would acknowledge that talking to someone else who's gone through this or who has some experience in concussion, these people sort of get you. And it's really wonderful therapy to be in a room full of people who have had that shared experience. I do see patients one-on-one as well as in group therapy sessions, and that therapy can work on things to compensate for the difficulties that you're having. They can also be treatment strategies that look to harness neuroplasticity, and we know that brain can change in response to targeted intervention, and that's so encouraging and something we want to make sure people understand and appreciate. And as much as possible, all of that is context-based. So SLPs do all of that work in constant conjunction with the patient and input from that individual and team support along the way.
Awesome. And sorry, this one isn't, I guess, a prepared question or anything, but is it publicly or privately funded for like how, I guess, how would people be paying for it? Is it through like OHIP or would it be private?
Yeah, so it depends on which speech language pathologist they would be seeing. There are both private and public practitioners. And I think there's a question I'm going to answer a little bit later that's about how to do that. But if you're asking about sort of where I work, that's an OHIP funded system. So I'm pleased to say that currently there are some wait times, but it is a OHIP funded in the province of Ontario.
Okay, yeah, I wanted to ask that before I asked this question, obviously. So how can people find other speech language pathologists? So for instance, May, I know she's in the Belleville area. I know Logan's in Ottawa. How can they find like a specialist in their area?
Perfect question. So there's actually a public register through the College of Audiologists and Speech Language Pathologists of Ontario. So I'm just going to go slowly here so you can write this down. The website is www.castlepo.com, and Castlepo is spelled CASLPO.com. What's really interesting about that is you can filter by city, by name of the speech pathologist. If you might remember my first name, but not my last name, you could find me there. It filters by languages spoken. So if you're someone who needs services in a language that is other than English, there are lots of individuals that you could filter through there by your area. The age is treated, and again, back to your point, Ryan, about the private versus public, it will indicate that on that site as well. So again, that's www.castlepo.com.
Amazing. I'm certain we'll get a link up into the chat sometime soon. Yeah, it looks like Seth. Yep, just got one up there. Awesome. Yeah, so I guess we'll be seeing you in the panel discussion phase. Thank you so much, Penny, for answering all the questions here today. Really appreciate what you brought to the table, and I know I learned a lot, and it's amazing work that you're doing, so thank you so much. And anybody who's listening who has any questions for Penny, we will be doing a discussion phase at the end after all the speakers, so feel free to put those questions in the Q&A whenever it's convenient to you. You can do it obviously during the panel discussion or whenever you feel like just putting it out there. So thank you, Penny. I'm going to pull you out now.
My pleasure. Yep.
Yeah, awesome. And then we're going to bring in our next speaker. And Logan, it's Seth, sorry, go ahead.
Thanks, Ryan, and thanks
Yeah.
again, Penny, for everything. I was trying to, type as you were letting everyone know the link to give it to them. But that was super awesome, and we're really excited to bring in this next panelist, Jennifer Buchanan. And Jennifer is the founder and visionary architect of JB Music Therapy and has been instrumental, no pun intended, in the implementation of hundreds of music therapy programs throughout Canada for 30 years. She is also the executive director of the Canadian Association of Music Therapists. And as a result of her amazing work throughout her lifetime in the industry, she's been awarded with the two most prestigious awards in this industry. And we are so grateful to have you here, Jennifer. How are you?
I'm good. Thank you for having me.
Oh, thank you for being here. And in case I missed anything, I know that was kind of a brief intro for your many accolades. Is there anything you want to add to that?
No, it was perfect. Thank you.
Okay, awesome. I'm glad to hear that. So I guess the first question that I want to ask you, and I feel like you are the perfect person to ask, is what is music therapy for people that may have never heard of it, and how can it help someone dealing, with a brain injury?
We're a profession that started in the late 70s here in Canada, although it was starting to become music therapy post-World War II when people were in pain, but medication was scarce. And using music as a means to see people being able to feel distracted and away from their pain was the first evidence that something was happening and music could help. And when we became a profession, of course, then we started schools across Canada, internships, and now there's board exams that music therapists write in order to become an MTA, which is a certified music therapist here in Canada. Essentially, we're frontline workers. We are creating relationships at a one-to-one level and with small groups, predominantly in healthcare, but also in education. We see a vast array of individuals from the classroom to corrections, from ICU to palliative care. And of course, we work a lot in neuro rehab. At the core, at the essence of all our work is music, because for us, there's no it's this efficient and effective way to activate the brain processes that we talk about. And I would say that the 4 reasons people contact us the most is what I call the 4 M's, which is mood, motivation, memory, and movement, mostly around gait and balance. And to Logan's point, we are often working within a care team and not in isolation. Although at times in community, people will be hiring us for some transition periods, but most of the time we're a part of a bigger care team.
It's super fascinating, and I really appreciate you providing all of that context. Because I feel like, as we've been through this journey, I've always been a huge, fan of music, and I know how much it impacts me on an emotional level. But sometimes when you're going through a concussion or a brain injury, you don't necessarily realize how something like music can benefit you. So I guess my question with that said is, can you explain how, someone with a concussion or TBI can benefit from seeing an MTA?
Yeah, and Seth, you're making a good point because at every stage, the music therapist will work with you differently. So we also, so I've got a team of therapists, and one area we do serve is right at that acute level, which is ICU. We are working in there right now, and we have worked there throughout COVID. And the work there, if I was going to define it, our pacing is going to be slow. The music is going to be slow. It's going to give time for the brain to to connect to whatever it possibly can. We're going to be using music a lot for soothing, comfort, company. And we've noticed a lot through COVID, people, of course, not being able to see their families and being isolated, that the music was an opportunity for them to connect to their loved ones through the music that their loved ones love. And so we can use music in that way. And then when we're on a really active, vibrant rehab unit, and if any of you have been on those units, it's busy and bustling. And we can use music in that way to co-treat with other therapists. We may be working with physiotherapists and using the music to create an environment of motivation to establish or reestablish a gait that the person has lost. We will be working with someone to be able to do some word finding, some memory work, and letting the music help us do that. As we all know, when we are learning something as simple as the alphabet, we learned early on that tying that to the song just made it easier for us to be able to assimilate that into some functional use. So we will be doing very specialized techniques around music in regards to that. And then we also will go out into the community, and that's where my entrance into working with acquired brain injury. In 1991, I connected with the Association of the Rehabilitation of Brain Injured here in Calgary, Alberta, and it was the first standalone community practice that we had, and that's where we started working with people who were even 2 to 10 years post-injury. And again, the goals are going to be different for every person, but often within that realm of the mood and the memory, motivation, and movement. It'll be somewhere within that.
I think it goes, I mean, to that point of an individualistic recovery that our goals become different. And it, I was thinking as you were talking, and I didn't really, prepare this question, but I am very curious, like, have there been experiences where firsthand where you've, brought music therapy to, a group of people or to an individual, felt pushback, and then saw like a transformation at the end? And can you kind of tell us a little bit about that experience?
Well, yeah, you and I are going, oh gosh, we love music. Music should be able to help with everything. You know what? Music can be really annoying. and certain rhythms can grate on you, and a certain voice can be really frustrating. And so this is where also that personal relationship that I'm not going to say that every music therapist is going to connect to a certain person. It's a therapist, and we have strong connections to certain therapists in our life. I've also known individuals who are at feeling either shy, withdrawn, nervous about joining a group experience, and we do quite a few small groups, and that can take more courage than what we may have in the moment to actually join. As a therapist, that's when we speak to the team and ask to do a few individual sessions, get to the root of how can we support you to move into the group setting. We have seen tremendous success by that, just that opportunity to have a few music therapy sessions privately, learn what it's all about, get a feel for it, and then be able to come in and share and make music with others within your organization.
That's fantastic. I think it's sometimes you need a little bit of that push from almost both perspectives and find a middle ground. So it's great that you've been able to kind of adapt and try and problem solve, because I imagine, throughout all of these different modalities that we're talking about, there is some hesitation for, you know, patients, especially when, as Logan mentioned, you try so many different outlets. But, you know, it's made me laugh when you're talking about how music can be annoying, and I'm thinking about the generational difference as well. And
Right.
and there is obviously this, like, it's different for
Yeah.
everyone, and it provokes a lot of different emotionality as well. And so I guess I want to know, for people that are all over the country, where can they find, you know, music therapists? I know JB
Mhm.
Music Therapy has really, you know, set a great precedent. So maybe you can also talk about how your organization has helped, you know, broaden this type of treatment for people all across the country.
Oh, thanks. So, yes, JB Music Therapy is very local in Calgary. We do offer virtual sessions, but I'm also very grateful to be the current executive director of the Canadian Association of Music Therapists. And I can tell you there are music therapists across this country that are constantly getting all the research that we can find to inform our practices, both clinically and publicly. Clinically, I meant privately and publicly. And so we are able to inform our practices and serve this array of needs that our society has. And if you want to find a music therapist in your community, and I highly recommend you try. If you're looking for benefits in the areas that I've been talking about, and you can go to musictherapy.ca. That's our Canadian association. They will help you find someone in your region. And we have provincial associations across the country, and many now are connecting with other counseling therapies and other psychotherapies and other allied health professionals. So hopefully you'll be able to find one. Otherwise, just send me an email direct and I'll help you.
Awesome. And I think we'll have Ryan put that all in the chat as well. And super beneficial for people out there trying to explore different, you know, forms and modalities. Music can be great, as we've heard Jennifer talk. And, you know, beyond being a music therapist, you're also an author. And, you know, your latest book, Wellness Well Played, The Power of a Playlist. You know, can you tell us a little bit more about that book and where, you know, people can
Yeah.
find it if they want to read it?
Oh, thanks, Seth. So, this book came from, of course, one of those really interesting techniques we can use in music therapy, which is our music-based life review. And if you just think about it right now as to the music you listened to in your childhood, definitely that junior high, high school time where we capture all our music, and now into our adulthood. And this book was written at this time because of the pandemic, because people were feeling drawn to music and curating their values as they listened to it. We were reminding ourselves of the moments that are meaningful, and music is often anchored to that. So Wellness Well Played can be found at wellnesswellplayed.com, and I would love it if you would explore that. And again, please connect with me and we can talk about it. Right now, we're doing a hashtag #MyPlaylist 2022. So we can take the feeling we want, put the playlist together, and take it right into 2022 together. So follow me on social media, and I've put some videos together that we can work that out together.
Awesome. Thank you so much. I know Ryan and I will probably put together a little playlist. And I think we're all in that holiday spirit when it comes to our music,
Right.
but I love that initiative, and thank you so much. Such tremendous insight, and again, you know, I touched upon it earlier, like music has been such a key instrument for me going through a lot of my mental health and recovery. So just super grateful to have you here. And I know we're going to bring you back at the end for a little group discussion. So thank you so much for everything, Jennifer. We really appreciate it.
Thank you.
Awesome. I'm going to pass it over to Logan to introduce our next panelist.
All right, so we're going to have Krystal join us. Krystal is a concussion warrior and registered dietitian who helps people with brain injury find healing with food and nutrition. Krystal has had multiple concussions herself and has noticed firsthand how impactful diets and supplements can help with day-to-day challenges TBI survivors are faced with. Her work focuses on making nutrition accessible, sustainable, and kind, considering the impacts trauma can have on our nourishment. So welcome, Krystal, and thanks for joining us today.
Hi, thank you so much for inviting me here. What an awesome panel.
Is there anything that I missed that you would like to share a little bit more about your work?
I just love food.
That is fair. Me too. So, well, I'll start right off then. How can a dietitian help someone in their concussion recovery, and how big of a factor is nutrition to concussion recovery?
Well, I think we all know from experience that when we eat better, whatever better means for each of us, we feel better. And when we have a concussion, there are so many challenges that show up to just eating. So how a dietitian can help, I find in my work, is really making nutrition accessible. Another piece I find, just being a part of the community and seeing like all the questions and the discussion that comes up about nutrition, is there's a whole lot of advice out there, a whole lot of research, and it can be very, very overwhelming to try to synthesize it all and put it into action and figure out what's best for you. So that's where I feel like my job as a dietitian is really guiding people to figure out the best plan for them. And as a result, by making nutrition accessible, we eat better, our brain gets the energy and the nutrients it needs to heal, and then we feel better. Yeah, how much, second part of your question, how much nutrition is a factor in concussion recovery? I think everyone here today will be like, my thing is super important, and it all is. Every domain is important. Call back to the previous panelists saying how, having a team of different people is key. One thing I definitely notice is that there are a number of people that I meet or that I work with where just eating can be a challenge. Maybe because of nausea, maybe because of pain, maybe because of swallowing difficulties, maybe because of gut stuff that has flared up after the injury. And so when a person is having and really struggling to eat, then nutrition, I find, is key, because how can we move forward potentially doing our physical therapies or being engaged in our appointments or being able to follow what's going on if we're not nourished? So I find for the people who really struggle to eat, that is where nutrition is key from the get-go to be able to make the best of like all of their therapies as well.
Yeah, that makes sense. I mean, I've been there, done that, where you're eating too little or eating too much sometimes, and you're trying to figure out how to best bring it into all your other treatments. So can you explain how you address a person's individual nutritional needs throughout their recovery?
Yeah, so what I love about this question is it highlights the importance of an assessment. So I find there is, and I think we can all agree, and then we're coming to the new year where diet advice is everywhere. A lot of nutrition advice is often given without an assessment. And so when I'm working with someone with a concussion throughout their recovery, I am assessing the classic things that need to be assessed, like what kind of foods they're able to eat, their cooking skills, their access to food, any digestion problems, all, the whole digestive system from mouth to poop. There are an enormous amount of questions I can ask about poop. You would be shocked. So getting an assessment of just like the things that affect someone's ability to eat, digest, and absorb food, but also where they are at in their recovery. So when I'm helping people progress with their nutrition, I'm sort of considering it in like a framework that works from the bottom up. Okay, what do I mean by that? It's like, well, first at the foundation, we want to make sure people are getting enough food and often enough. That is the first thing we need to satisfy. Then after that, we can move on to getting some balance in terms of foods and food groups, then variety, then move on to flexibility, and then we can get to the tip top of, being able to like really play with nutrition. So when I'm looking at helping someone through their journey, I'm considering where they are at in that, in that kind of scale, and what are the obstacles in the way to getting to the next level? What is getting in the way of just eating every day? What is getting in the way of having variety? And this work here is my favorite part of my job, and probably not what people expect from me, because this is where I get into talking about someone's food story, what food has been like for them in their life, what food was like for them growing up, what beliefs they have about food. Are they the kind of person who's like, oh, if I could just take a pill and not have to eat, I would do that? Or are they the type of person who's like, man, I am like a chef in my kitchen, but not since my recovery. So working into the figuring out, well, why is it that we choose the foods we do in the moments we do, and like really getting to the root of that. That is where the good stuff is in terms of nutrition, I find.
Most definitely. I've definitely grown in my nutrition, and even since my concussion. So it's interesting to see how you can piece it together, and it's difficult, definitely difficult. So having that assistance, and sometimes even breaking it step by step, and having someone help you or hold your hand through that process is such a big help. So I guess then, how does your practice differ from other dietitians? I know myself working with you, I've experienced it, but can you explain it to our audience how it differs so much, so drastically, and why you think it can be beneficial to those with a concussion and a TBI, with a concussion or TBI?
Yeah, thank you. That's like, it's a very big compliment. And also, I will just say, like, there are many dietitians out there in their own niches who are just killing it, doing the things they need to do for their population. For me, I would say that, what makes my work different is I have been there. I have had multiple concussions. I have been in the kitchen staring at a recipe that I had made 1,000,000 times before and could not even do one step. I have had a fire on my stove. I have not been able to walk. I've been lost in the grocery store so many times. So, having been there and understanding when I see all these diet recommendations that are, very restrictive, cut out this and cut out that. And then when I consider what it is we are living with day to day, I'm like, we need something completely different. So the work I do, I guess the biggest thing I consider is making it real for people and making it accommodate whatever their symptoms or place in their recovery they're at. So for example, everything on my website is recorded in audio. and it is my voice, not a computer. So it's one way to make it accessible. The work I do in my program, I wanted to give people, concussion warriors, TBI survivors, different ways to intake information. Like we heard from our previous panelists, reading can be a challenge, memory can be a challenge, and like holding in information. So in my program, I support people a few different ways. I have online resources recorded in audio, like mini podcasts, just breaking down the background nutrition information. Then I have individual sessions where we can work on that plan, and we can, we can tailor goals and objectives and do like, the food journaling and like calculate stuff, the stuff that we all expect to do. And then I have the group mentorship aspect of it, which is my favorite part, because this is where we come together and, okay, I know what to do, but I'm having a hard time doing it. And this is where we can really, really get that compassion. We can really feel not so isolated in our struggles, and then we can draw on the wisdom of the group to help us forward. Because, I may be the nutrition expert, but all of you are the experts in your own life. And food means something different to everybody. And there is no way that I can know every single recipe or every single dish or every single way to have fun with food. So we bring that together in a group mentorship to support people that way too.
I definitely like the group aspect, because then it brings you another community as well, which is super helpful. And I like that you can go at your own pace, because there are days where it's just too overwhelming to go to your appointment, but it's already scheduled. So
yeah. So much flexibility. I do not have a cancellation policy. I have showed up to appointments on the wrong day. So yeah, I get it. I get it.
So I guess that leads right into my last question. How has your own concussion journey led you to changing your practice?
Yeah, when I think of like how I practiced before to now, it is extremely different. So, before my concussion, I very much worked in traditional dietitian roles, which are great. But then when I came to starting this practice, it was being a part of the community and seeing the questions and the problems come up in support groups and with friends of mine in the Brain Injury Association that really got me to do this. So, for example, like the real tipping point was, a friend of mine came to me one day when I was sort of debating, am I going to start, a practice in brain injury or not? And she said to me, oh my gosh, Krystal, like I have another practitioner who's telling me to do this diet, this diet, this diet, cutting out all these foods, taking these hundreds of dollars worth of supplements. And I can only buy food at one grocery store. It's stressing me out. We need your help. And that piece of me is what keeps me going every single day. That I know that there are people out there for who food and diet has become an incredible stressor, where the trauma of having the concussion or having the brain injury has brought up trauma with food. I do see a number of people that I work with where, issues they had with food when they were younger come back up now post-concussion, or they maybe had an eating disorder beforehand or not, and then post-concussion, that trauma has sort of like kick-started it. So Yeah, so like just being a part of the community and knowing that food can be healing so much more than just the individual nutrients that are in it. How we view food, how we interact with food. If, you know, theoretically, we're interacting with food 3 or more times a day. If each of those times is super stressful, and you're not going to feel well going through your day about it, and food is going to become just more and more of a stressor to you. So yeah, my own experience has just really brought me to just want to bring this other perspective, that there's a way we can look at food that is super kind and super healing, without having it to be this big, restrictive, stressful thing.
Definitely. I've seen that transition in myself with food. So it's wonderful the way that you portray that to your clients. I do thank you for joining us. And I know that you're going to be coming back for our panel. So if anyone has any questions for Krystal will be there and can answer more questions. I think in the meantime, Ryan's going to help transition Krystal out and bring Dr. Joseph Lawrence in for us. So thank you, Krystal. I really appreciate all your knowledge and expertise that you've shared today.
Thank you.
So to help transition here, I'll introduce Dr. Lawrence. In 2015, Dr. Lawrence was granted status as a fellow of the American Board of Brain Injury Rehabilitation after completing over 400 hours in mild traumatic brain injury and vestibular therapy at the Carrick Institute of Graduate Studies. Today, he likes to incorporate leading edge technology such as laser therapy, advanced traction protocols, and active therapeutic movement, which can help speed rehabilitation of targeted muscle groups. Welcome, Dr. Lawrence, and thank you for joining us. Is there anything that I may have missed that you'd like to share a little bit more?
All right, there we go. Thank you.
Of course.
No, I think you pretty much hit on most of that. Essentially, what you had referred to was mostly the musculoskeletal portion of the type of practice we do, but in effect, we also look at things that are related to the oculomotor and physiological system of the complexity of concussions.
Perfect. So I guess that leads perfectly right into our first question. Can you explain the 3 main components of the concussion that you addressed at your clinic: the physiological, vestibular, ocular, and the cerebrogenic?
Right. Well, this is really something that's near and dear to my heart, because I think anybody and all the panelists did a fantastic job, by the way. So thank you for that. I think it's really important to understand that it's no secret that concussions are a very, very complex condition. And so the fact that you have a community approach to treating them is very important. In fact, we here don't really like to work in a silo. We really, enjoy working with the, factors of the parts of concussions we can't deal with and utilize a team approach. But when it comes to the complexity of a concussion, there's 3 main categories, as you mentioned: the physiological, the vestibular, and the cerebrogenic. And very simply and briefly, the physiological component is really referring to what are the symptoms someone would experience when they have an injury on the cellular level. And, for some of those individuals, some things like light and sound sensitivity, headaches made worse with cognitive or physical exertion, fatigue, nausea, sometimes dizziness, sometimes vomiting, slurred speech and slowed speech as well can occur. So there's a different approach you have to dealing with that part of the injury. And that typically is a part of the injury that is one of the slowest to heal. Secondly, you'll have the vestibulo-ocular component, which generally refers to the oculomotor and the balance mechanisms in the brain and brainstem that can be injured with a head trauma, which can occur from a torquing or a contre-coup, or this movement of the brain inside of the skull. And typically those individuals will have issues with vertigo, headaches made worse with reading. They'll have the sense of postural instability when they're at rest, issues with difficulty in very busy environments. This time of year, Christmas, these individuals just can't go to shopping malls because it's just overwhelming for them, or going to sporting events, etc. And also light sensitivity is another factor. So you really will understand that when you have this vestibular ocular component, the issue is this ocular motor and balance function. And I know right now the darling of concussion treatment is eye therapy or visual therapy, which is important, but it really is only a thin slice of the whole pie of treating these things. And finally, we have this what's called the cervicogenic component, which is really the effect that injury to the neck, how that can affect an individual's symptoms for concussions. And again, one of the conditions for that or symptoms for that is headaches, occipital headaches made worse with head movement. And this is important because there's a great deal of vestibular input from the neck for individuals. And if they do experience head trauma, they can have neck pain, which can in fact affect their balance as well as their visual system. So one thing that we always caution is if an individual has a concussion symptoms and they do have neck pain, sometimes working on the neck first might not be the right idea to do, because you may want to look at other comorbid factors that could be coming from a top-down issue that might be important to look at first before you start working on the neck. And you'll know that if it is a top-down issue, working on the neck usually has not such a great outcome, but down the line, it may be an area that needs to be addressed completely as well.
Okay. And so how do you assess a person with a concussion when they come into your clinic?
Well, of course, there's, and I won't, for the sake of time, there's a number of standard intake forms that are required, different visual analog scale, different types of VAS scales, as they're called, to quantify subjectively a concussion. It's really broken down in two parts. There's a bedside exam and an exam that uses some advanced diagnostics that will help to quantify these things. Because what happens with a lot of concussion diagnostic approaches is it tends to be a little bit subjective at times. And again, I'm not criticizing anything, but it makes it difficult for individuals to state their case that they do have a concussion, either to third parties or to family or friends or what have you, or even to themselves. So the bedside examination is quite detailed. We'll look at a lot of signs that will be attributed to different parts of the brain, either the parietal lobe or the cerebellum, parts of the brain stem, the frontal lobe, most definitely. It's important to note that, most concussions, individuals will have injury to the frontal lobe and the top part of the brainstem called the midbrain. So our examination procedures will, without getting into, the rabbit hole details of that, are directed towards that. And then the second part uses advanced diagnostics that will help to quantify an individual's injury that will be compared to normative data for some age-matched, gender-controlled individual that never had a concussion. So, when it comes to advanced diagnostics, one could easily say, well, what about MRI? Well, MRI is definitely an advanced diagnostic. However, in most cases, MRIs are negative with an individual with a mild traumatic brain injury, because it's looking for more or less a space-occupying lesion, whereas what we have to look for is what's called a functional lesion. Is how does the brain work when demands are put upon it for, say, example, reading or understanding a question or following a command or solving a problem, for example, or going into a lighted room or a room with sound, so forth. What we want to do is we want to use a diagnostic will actually show us how that part of the brain is working. The beautiful thing about that is that different parts of the brain have different visual and balance tasks assigned to it. So when we test the brain and find out how that person responds and compares that to normative data, we can really have a good idea of how well or far away from normal they are. And also that data is used quite extensively in outlining a treatment protocol as well.
That's great. So I know that everybody that comes in, everybody's going to be a little different. Their injury is going to portray a little differently, with whether it's subjective or objective with your advanced diagnostic. So how do you decide a treatment plan for each of your clients, and what are your treatment options to be able to provide to people?
Okay, that's a great question. So this is one thing that is, again, sort of very near and dear to my heart, is that one of the last things you should ever do for a concussion treatment is go treat a concussion in a very formulaic approach, which means to say, we're going to give eye exercise where the person is going to turn their head left to right, do these type of, therapies that are very, in a booklet form that could be, utilized for, a great number of people, when in fact, that's not really the way to go, because all these injuries are very individual. Individual may have a different finding for their eyes going to the right, going to the left. You wouldn't want to give them eye exercises going both ways, because that's really not going to take them, to a great deal of advancement. So one of the main ways to determine the program of care is really looking at their metrics of their examination. And it's like a fingerprint, really. And so therefore the treatment protocol should really be based on that individual's findings. So they may have difficulty looking up as opposed to looking down, with a lot more of a jerky eye movement, for example. And we'd have to formulate a treatment program, for example, in that small case. Where are we going to help to work on the individual's vertical motion of eye movement, and what can we do at that particular level where that jerky eye movement occurs? Or if they have a problem with standing and they keep tilting to the right, there's certain therapies that are designed specifically for that. So the point I'm driving at is it has to be very specific treatment protocol based on their findings. And then, of course, once that program of care is done, then what we do is we compare their post-exam findings for their original exam findings, and then we can have a much better process beyond their subjective response, having more of an objective response to see how they're responding and whether there things need to be done or changed, or maybe have another different type of practitioner address the patient. But it's very, very clearly based on their specific findings. The treatment program has to be made around their specific findings.
I can see the benefit of that, because everybody is different and everybody needs different treatment. So I know that your clinic offers such advanced treatment options. What all do you have in your clinic that can be available to some of your clients based on some of their varied needs?
Sure. Well, let's look at the physiological component. If we're going to be dealing with that, you had one of your panelists talking about nutrition. It is extremely important. You'd want to do a very detailed, panel of analysis, a CBC, complete blood work, checking for glucose metabolism, because the brain requires oxygen and glucose. So you want to make sure you take a step back and making sure that, they have the proper fuel for the brain in order to, undergo treatment. And we'd also be looking for things like, is there a problem with leaky gut syndrome that can also cause brain inflammation, which people, is code for brain fog, as people call that. And you also have looked at what are some of the pre-existing conditions an individual may have before they came or had their concussion. Do they have pre-existing thyroid problem, or did they have an issue with irritable bowel syndrome, or did they have blood sugar dysregulation that's been worsened with their concussion? So you have to look at the history that way. But from a treatment standpoint, we may use things like, vagus nerve stimulation for gut function, or we may use somatous evoked potentials for, balance problems, which is stimulation of the tongue, or what's known as pons stimulation. Also for the vestibular ocular component, we use an evidence-based protocol called head-eye vestibular motion therapy, which basically is utilizing an individual's metrics for their findings and devise a treatment for eye therapy and balance therapy based on the results. And it's really important. It's not a treatment per se. What it is what we've done is, and with head-eye vestibular motion therapy, which is in the literature, the only one I know of that's evidence-based, is that we draw from different specialties and put it together. It's kind of like, one of my mentors said, it's like everybody makes a souffle, but it's how you mix those ingredients together to make the souffle is how we treat patients. And we hope that our souffle is a little more fluffy than most, but it's not one particular treatment modality we use. We draw from a lot of different ones. And then with the cervicogenic component, when we are ready to look at, the neck problem for patients, we may use things like laser therapy or traction or isometric strengthening or mobilization, manipulation. There's a number of things we have at our disposal. And we want to make sure that based on that person's capacity, that we use the proper treatment that won't exceed their capacity. Because when you're treating patients with concussion, one thing that's super important is that patients have different levels of fatigability. So what you may do with one patient in one room, then go to the next, you may be able to push one person a little harder than the others, but it's important to always keep an eye on what their fatigability is, because We want to make sure that a patient can only take what they can for that particular treatment. And then, of course, after that, depending on how they progress, we can still use different approaches for them to, with respect to those interventions that we've described there.
Yeah, that's great. It's interesting to see how different everybody's treatment can be, and how, for me, I've seen you obviously, and seeing how I progressed, and each step of the way changes just a little bit with what you do because of where you are in your recovery.
Right.
And I know that you started off as a chiropractor to begin with, and then you transitioned into concussion treatment and more TBI treatment.
Right.
I'm also aware that you sustained your own concussion. So how has your concussion journey led you to changing a little bit in your career and changing your practice?
Well, I think it was really, more than a little bit in my career. What happened was when I sustained my injury, I was entering into my first year university, and coming out of high school, I had pretty good marks, and my first year of university, I was on the dean's probation list. I mean, that to me was going from 100 to 0, and the stress of that was just overwhelming. So the pathway that I took, searching for help for my injury, was long and tortuous, I can tell you that. And that's one thing I think is a bit of advantage for me, because I can really identify with what happens with individuals when they go through with these are exposed to this type of injury. So really it was a 180-degree turn in my practice, because when I was in practice as a chiropractor, yes, I'd see concussion patients, but my success rate was, I'll be honest, was very, very spotty. Some patients would do fine, but the majority of them, I wasn't getting anywhere. And to me, that was frustrating, both professionally and personally, for my own recovery. So when I, basically stumbled upon the approach with Dr. Carrick, who is, one of the leaders in this field, I really wanted to find out what field was the one that, was the most evidence-based and was the most detailed in effect. And it was a very long and tortuous journey as well to go through the education for that. It took quite a number of years to get certified in this. And the success rate, thankfully, now for treating patients is considerably better. And it's really important, because what I didn't know and what I know now were vastly, vastly different. I still don't know quite a bit about it. And that's why it's always an ongoing educational process for, myself and Dr. Guillemette, on a daily basis, weekly basis. We're always, required to do quite a bit of continuing education. And I do that really for my own benefit, as well as, wanting to be much, much better for treating our patients here.
That's great. Well, thank you very much. I really appreciate you joining us. You will be back, I'm assuming, for our panel discussion. So anybody who has questions can put them in our Q&A, and they can be answered after. In the meantime, I think Ryan's going to help us transition here with bringing Dr. Lawrence out and bringing Dr. Guillemette in. Dr. Guillemette works alongside Dr. Lawrence at Broadview Spine and Health Center.
Thank you so much for that, Dr. Lawrence. Really appreciated all the insight that you just brought. Very, really impressed with the way that you go about treating your patients, and just that whole process, and even the fact that you have personal experience too. I think it does make a difference in your practice, and you can tell by the passion level that you have, for sure. So to introduce Dr. Guillemette, I see him here now. So first of all, thank you for joining us, and I'll do an intro here for you. So Dr. Guillemette is a board-certified chiropractic neurologist from the American Chiropractic Neurology Board. He combines his unique skills and knowledge in neurological function to take care of traumatic brain injury patients. Dr. Guillemette has been practicing and helping patients with neurological conditions since 2014, and has been working towards getting his accreditation from the Board of Brain Injury and Rehabilitation. Did I miss anything there, Dr. Guillemette?
No, that's a pretty good summary, I'd say.
Awesome. Yeah, thank you so much for being here with us today. And nice to meet you in person, or virtually, I guess. So Yeah, I really appreciate that. And so some of these questions, because you do work with Dr. Lawrence, we will be kind of building off of what he's talked about. We know you slightly different what you guys do there, but we're going to try and tailor it to kind of filling in some of the gaps based off what we learned from hearing from Dr. Lawrence. So first one that I would like to ask you is, what are some common milestones that you see people go through within the recovery process? And are there any signifiers that you look for to help indicate that they're on the verge of that recovery or that milestone?
Yeah, that's really great. So essentially, it really does depend from individual to individual, depending on what their symptom base are with the head injury that they're suffering from. So in terms of seeing milestones or what changes they're going to be experiencing, we're really looking to see, say we have patients come in who have those really intense light or sound sensitivities. Sometimes we have people come in who have kind of the blinders, or they're wearing their sunglasses all the time, or some patients kind of have earmuffs. So if we can really try to either get them outside or in the environments where they either don't have to wear those blinders as often, or if they don't have to wear the earmuffs as often, those are really great achievements. Some other things might be with in terms of if someone has very large balance deficits. So if we're able to kind of get that, get their mobility going a little bit better, kind of allow them to walk around without kind of impeding themselves or hitting the walls or kind of falling over. Those are some great changes that we can often see. And sometimes the changes are as simple as a lot of concussion individuals have some struggles with regards to just driving in a vehicle. So just getting from point A to point B. So if we're able to give some strategies, or if we're able to see them kind of make it through a 20-minute car drive at first, and then they can maybe proceed to maybe a 30 or 40-minute car drive, and we notice that they're not completely fatigued by the end of that, those are some really good milestones that we can kind of see and achieve with a lot of our patients. So it does really depend on the individual. If it's headaches, maybe we're seeing some either less frequent headaches, less intense headaches. So those are all important factors to kind of consider when we're looking at individuals who have suffered from concussions, and kind of taking a note if we're seeing some progress in terms of less intense, less frequent. Those are all great things we're looking for. Now, for determining if someone's on the verge of recovery, well, that's kind of one of the things that our clinic's a little bit unique with, is the fact that we have some fairly advanced technologies here that we use to diagnose and treat our patients. So we have three primary machines that we use. One's called the video nystagmography, one's called a sacudometer, and one's called a CAPS, which is a comprehensive assessment of postural systems. Now, all three of these devices help us to get quantifiable numbers on the patient in terms of demonstrating some deficiencies that they may have. And we get to compare these again to these normative standards. So when we're doing or we're treating patients after 1, 2, or maybe a couple of weeks, we get to retest them to compare where they started from to where they currently are. And that can really give us some in-depth information with regards to, are you progressing the way you should be progressing? And if you're starting to kind of hit more and more of those factors, it kind of leads us down the details of knowing that if you haven't quite seen symptoms change yet or things progress yet, more than likely you're about to. So it's a really kind of a nice thing, because there's not that many places where you can actually see something that's very quantifiable, very objective in terms of being like, yep, I was here when I first started, I have these symptoms. Now I'm meeting all of these symptoms over here, and you kind of get to see that nice progression happen.
Yeah, no, that's the individuality of the injury. It's so important, and the fact that you're considering that with your practice is very important. And I guess another question I have for you is, how does treatment and the general recovery process differ for someone who's had multiple concussions or seeking late intervention of a concussion?
Yeah, so that's another great question. There's a lot of people, some people it's a concussion that they only have for several weeks. Some people it's several years. So the length of time from injury obviously plays some factors. The sooner you start working with someone who has a head injury, the better it is, because essentially our brains are amazing. They're always changing, they're always adapting. Essentially, our brains want us to be able to function as best as they can. So sadly, that is both good and negative, because our brain can sometimes create some loopholes or some workarounds to certain systems that aren't quite functioning right. So as time goes on, it could become a little bit more difficult to help some patients who have some long-term head injuries. Now, that doesn't mean that it's impossible. It just means that we're having to kind of peel back some layers of time in terms of what it's caused in terms of changements or let's say, I guess, crutches in certain circumstances. So with most individuals, again, we get that kind of that perk of having the diagnostic tools, which allows us to kind of see, even if we are helping these patients, are we working our way towards some positive changes? And if we are, that's great. One of the things I always like to tell absolutely all of my patients is, doesn't matter how big or how small the changes that you're making, as long as you're able to make a change, usually that's a positive indicator that you'll be able to progress and get a little bit better or a lot better, depending on your circumstances, from where you currently are with the concussion that you have. Again, when we're looking at time frame, that's kind of that. But when you're looking at multiple concussions, again, that's one of those things where it can be a little bit more difficult to help someone who has several concussions compared to one concussion, because several concussions, you might have multiple issues that build up on each other from each subsequent head injury. So the way we always like to do it is, again, it doesn't make it impossible. So we always typically start with the most prominent issue and try to fix that first. And then as that improves, we try to work our way down to some of the more, maybe not as problematic problems, but again, it's kind of like you peel away at it. So multiple concussions, they're typically patients who are a little bit more dynamic. But again, we see kind of in our clinic that a lot of the patients who end up with us are ones that have multiple concussions, because they tend to be a little bit more complex, a little bit more difficult to help, where the stereotypical treatment programs might not work if you're kind of someone who's suffered from multiple head traumas.
Thank you so much for that. Yeah, I'm definitely wondering, because I've sustained multiple concussions as well, and just trying to understand how it does differentiate is something I'm definitely passionate about learning. But I guess another question I do have for you is, I see the vision board, or whatever you call it. Is that behind you there?
Yeah.
So what are some things that you do in clinic, and some things that you do or recommend for people to do at home that they can do?
Yeah, so again, it's really individualized per the type of concussion we're dealing with. Is it a vestibular component? Is it a mostly ocular component? Is it balance-based? Is it nutritional? So the therapies we use, they range quite significantly. So the diagram you see on the back here, that's just one of the tools we have to kind of help with certain patients. So we can use that star-shaped diagram for some tracking or some VOR exercises, so some vestibular ocular exercises. And again, we have a whole bunch of things, whether that be pons stimulation, transvagus nerve stim, just some hand-eye coordinative skills practicing, some balance-based exercises, some vestibular therapies. There's a whole list of things. And again, I know nutrition is always talked about, but it is definitely a super important aspect of the recovery with patients who have head injuries. When it comes to treatments that we can actually give individuals at home, that's kind of one thing I always tell absolutely all my patients is, from the day one, I always provide my patients exercise to do at home, because their chances of making a good recovery, a better recovery, and a kind of a recovery that will be more long lasting improve if you give some good exercises at home. So some of the things that we do are as simple as just giving some individuals some gaze stability exercises, where they're looking at targets and they're trying to get their eyes to lock onto those targets. But again, it really depends on what the deficits are that they're demonstrating. So there's a lot of visual cues, a lot of visual exercises that we can give you at home. There's a lot of coordinative skills that we can give patients at home in terms of doing maybe some balance-based exercises with some hand-eye coordination. There's also certain things in terms of, we know that memory is fairly problematic. So we can give some memory-based challenges or some memory exercises for them to do at home to try to either make that kind of forgetfulness or memory delays kind of be less problematic. So again, there's so many different techniques, there's so many different treatment styles, there's so many different things that you can provide the patient at home to try to make themselves an active participant in their recovery, which is really, really great.
Awesome. Yeah, I think like just being able to like work on it at home is so important, right? And it can make or break a recovery. I wouldn't say break, but it can definitely be something that helps you progress a lot faster if you're able to like do something at home every day while you're just sitting there, because oftentimes you are just by yourself or alone in some capacity. So having something to do that gets you off the couch or that's activating like that could definitely go a long way. So I could see the benefits there for sure, even if it's just small and you're just focusing on something and trying to have your eyes focus in on it, right? So yeah, no, I really appreciate that. I guess the one of the last questions I have for you is what makes your practice different from others in the field? And I guess why are you so passionate about this work?
Yeah, so that's a great question. And I know me and Dr. Lawrence have spoken about this time and time again. So much like Dr. Lawrence, I've had some circumstances with my family that individuals who have suffered some significant concussions, which kind of gets you down the rabbit hole of learning more, figuring out more, and just trying to really get to the itty gritty of how can I help these people or these individuals as best as I can. In terms of what makes our clinic unique, we really try to stand beside the whole emphasis of making things as research and evidence-based as possible. We tend to kind of like the souffle example that was provided with Dr. Lawrence. It's really what we do is we try to pick all these things throughout research that have shown to have success with different aspects of rehabilitation. So it might not always be specific to concussions. However, if we can figure out that someone with a concussion has, let's say, frontal lobe deficit, and we know that so many exercises or these types of therapies are very effective with frontal lobe function, then we can kind of combine that with our therapies to help these individuals. So the main thing with our clinic that we really like is firstly getting a really good examination done so we can really pinpoint as accurately as possible which part of the individual's brain is not working properly. Once we really know which part of the brain is not working properly, if that's the frontal lobe, if that's the cerebellum, a little bit of the temporal or parietal, or maybe just brainstem function, we can really gear into some very precise therapeutic exercises that we know can target those regions. So the great thing is that we get to quantifiably look at what's not working right, and then we get to put into practice all this research that says these therapies should help these brain centers. And then we get to look back at it and say, well, did it work? Is it working? Is it helping? And then one of the things that we like to do is knowing the fact that your brain actually works in one part of your brain stimulates another part of your brain, which stimulates another part of your brain, essentially means that we can kind of leverage different therapies to try to help different parts of your brain as well. So the more you kind of understand on how well the brain works with each other, the more you can kind of leverage things in terms of treatment programs to your advantage.
Thank you so much for sharing that. Yeah, it's such an advantage being able to like quantifiably identify what's going on and what parts are affected, right? And the fact that you have that at your clinic, I'm sure you've been helping a lot of people with that and being able to employ the evidence-based best practices on how you can stimulate those regions. So yeah, thank you so much for sharing. And yeah, if any, I shared a link in the chat there, Broadview Health Center. If you want to learn more about the work that Dr. Guillemette and Dr. Lawrence are doing. As of right now, though, thank you, Dr. Guillemette. We're going to go to the panel discussion where people can ask you questions directly about the work you're doing. So thank you so much. I'm going to bring all the panelists in right now.
Perfect. Thank you.
Thanks, Dr. Guillemette, and thank you, Ryan. I see we already have one question, Kimberly, and we will definitely get to that. And as Ryan mentioned, definitely put your questions in the Q&A. This is your chance to, speak to these amazing panelists and really get some incredible insights of, any types of questions that you'd like to know, as we do have a diverse panel here with their background and expertise. Awesome. So I believe we have everyone here. Great. I think we're just waiting on Dr. Lawrence. So we do have a few questions coming in. I asked that for all of our panelists, there is a raise your hand button at the bottom, just so I can kind of help me facilitate it. If you have an answer, just click that button and I will pass it to you. So the first question that Kimberly wants to know is, how can we get our family doctor to support a holistic approach to treatment? Now, I get that could be a bit hard as we're not, GPs, but I'd love to get your perspective, and we'll start with Dr. Guillemette.
Awesome. So that is a great question, Kimberly. A lot of the times I find it's not necessarily trying to get them on board, so because you really have to do what's best for you. And you'll see that a lot of GPs vary greatly from practitioner to practitioners. There's some GPs out there that are surprisingly very positive towards the holistic approaches, mainly because they know that the stay at home and rest isn't the solution for everything. So the other thing too is if you the proof is in the pudding. So if you're doing something and then you're seeing positive outcomes with it, there's no doubt that more than likely your GP will tend to switch their mind, which is kind of nice, because you might, if you approach your GP with that, you might get them more on board to try some of these alternative holistic therapies for other patients that they may have.
Thanks, Dr. Guillemette, and I'll pass it over to Krystal.
Awesome question. I think one of the things that I have been trying to do, because I know a lot of people and a lot of other healthcare professionals, just like all of us here, might not know exactly what the other one does. We want to work as this like multidisciplinary or interdisciplinary team, yet we all kind of work in these silos. So I can say, at least from my standpoint, one thing I've been doing has been doing webinars for other healthcare providers to be like, this is my role and this is what I have been doing. That way, they can directly ask me questions about it. Something else that might be helpful as well is if you feel like getting your GP on board is something you want to do. I can't speak for everybody, but sometimes if a client asks me to, or if I think it's beneficial, I write a note to the doctor and I say, hey, this is kind of the work we're doing. Here's how I think we could collaborate, or I'd love your input on this. And that also just helps get the word out there. But anyways, great question. No one solution.
Oh, I see Penny actually has something that she wants to chime in. So please go ahead, Penny.
Yeah, I just think with Krystal's point, it's always really good we sort of show up to our physicians with all of our list of things that aren't going well, and we need to do that. I do instruct a lot of my patients, and especially my return to schoolers, to remember to circle back to physicians and talk about all the great things that have come out of the referral if they've been able to get that referral. I do that as part of practicing gratitude, which we know is really evidence-based, and also just that people really like to share their success stories, and physicians, I think, need to hear that as much as they hear some of the challenges and problems. I happen to work with return to schoolers, so probably the single best thing is to take the transcript back after we've had treatment and have a look at those marks and those grades that the students are achieving. And probably the most rewarding part for me is to see students who were in undergraduate just thinking maybe they'll just get through undergrad, going on and doing their masters or going on and doing their PhDs, and entering into the field of study that they wanted, that they had a passion for. And I think it's just really important that we circle back to our physicians and talk about positive outcomes. I talk about student services as well. When students go and ask for accommodations, which is really important, and I write letters, and physicians write letters of support for accommodations. It's also really important to loop back to professors, instructors, and student services to say, hey, this really worked for me. I really appreciate this, because you're going to get more of that good behavior, I think, or that really good outcome.
Absolutely. Thank you so much, Penny. And I guess what I wanted to add to that, in your own perspectives, when someone comes to you, a patient, how can you best convey the importance of taking a multidisciplinary approach? And what are ways that we can kind of talk to, these people who are suffering these symptoms and say, hey, here's one way we can help, but there are a lot of other outlets. So I'd love to get someone's perspective on that.
This is when we do participating in a panel like this, where we're actually learning from one another and our colleagues, and then beginning to advocate for one another. I believe there's so much we can be doing with cross-sharing of information. In the social media, we could be sharing information when we're on podcasts, and again, doing it in a panel format, when we're collaborating on research and, bringing in the interdisciplinary and then sharing it from that a greater whole perspective. I think that's going to be, and continuing to do that, because I don't want to imply it's not happening at all, but doing it with even greater intention now moving forward.
I love that. No, that's beautiful. And I really appreciate that. Penny, see, you want to contribute?
Yeah, just to put a point, I think just raising our voices for one another. I think there are smaller disciplines, that may not be the largest of the groups of allied health support. They're less understood, but they're really valuable. So I love the idea of raising your voice to support the work that's done, the great work that's done by other team members. And so I really like that. Jennifer, that was great.
And I know that's why we want to provide such different perspectives for this webinar. So yeah, super grateful, and really I agree with that sentiment as well. And I'll move on to Megan's question, because I think it's such an amazing question for everyone, as we know that this is a non-linear experience. And Megan wants to know that in terms of gauging an individual's threshold for activities, what are productive ways to promote advancement without pushing too far, or some tips for supporting an individual who feels frustrated in the recovery, as we all kind of go through that type of experience in these recovery journeys, because they are a journey.
Oh my gosh. I mean, anyone who's been there knows, just like, it's not even not linear, it's a scribble on a piece of paper recovery. And one of the things that, for myself, for my clients, is having that compassion and building that compassion and kindness muscle, for knowing that, yeah, setbacks might happen, and that's okay. And also, we can move forward by breaking things down into like really small steps. So I know, with my clients, I think everyone comes to me expecting that I'm going to give them a meal plan. And I could not think of a more overwhelming thing to hand to a person with a brain injury. And, sometimes in sessions, a person, we talk about like what seems feasible within the next 24 to 48 hours. If whatever our plan is leaving something that we can do in the next 24 to 48 hours, then we know we're taking a step, and we know it's likely something that we can do. And that step might be as small as like the other day, I had a client who, they were like, one of the barriers to me eating is simply that my freezer is just completely disorganized. I don't even know what's in there. I can't even I'm preparing foods, but I have nowhere to put them. And it was like, cool. All we did was, she took a picture of her freezer. She walked away. She circled some things on that picture, and then took one item at a time and moved it or dealt with it. And that was that. So I know it's not those like small things like that. They're not like sexy, like in a sense. But those are the things that, when we do that over time, we can look back at that scribble and be like, wow, okay, the scribble is now at least going upwards.
Thanks, Krystal. And Dr. Guillemette?
Yeah, I agree with Krystal. It's I always say we always want to see a perfect increase in symptoms, but we know that's just not the case. So I always tell my patients it's okay to have a little bit of ups and down, little bit of ups and down, little bit of ups and down, as long as by the end of the road we are making that progression towards improvements. When it comes to kind of the first part of the question with regards to knowing when you're not pushing too far, so every individual is a little bit different, but it's kind of learning to read the physiological indicators with patients. So if it comes to headaches, and you're doing some exercises and you start to feel a little bit of maybe some pressure buildup or some kind of the pains coming behind the eyes, essentially that's kind of your body's way of telling you that you're starting to kind of go downhill a little bit. You might have to take a little step back. So certain indicators like that can be found for a lot of different patients in terms of telling you when you're reaching your individual thresholds. They're not always the same from individual to individuals, but reading kind of the way your body is and understanding kind of what the symptoms mean and when it means to kind of slow down or when it means you can kind of push a little bit harder. It takes a little bit of work and maybe a little bit of guidance for you to maybe realize that something is an indicator when before maybe you didn't really associate it as one, but there's definitely ways of kind of picking out those thresholds when you're kind of reaching the peak of what you should do and you should kind of maybe take a little step back, or when you're able to kind of push yourself a little bit more, because there's no doubt when it comes to head injury recovery, you are going to have to push yourself to a certain extent.
Penny, I'll pass it to you.
Yeah, sure. I may be a little biased on this one, but and I agree with your points, Dr. Guillemette. Those are great. At Parkwood Institute, we use pacing and planning graphs, and some of you might be quite familiar with these. They're developed by our team, and they've actually been included in the brain injury guidelines. Send this into the chat. So you can have that link to that resource. But I think that really helps in a very concrete visual way. We all learn sort of differently, but the idea here, if you've seen our graphs, is to know that, as Dr. Guillemette is explaining, that we can't sort of not have activity. We have to sort of work through, but it's figuring out where's the threshold. And for each one of us, that threshold's a bit different. And it also depends on the task that we're doing. So if we're heavily involved in cognitive tasks, for one individual, that can be very demanding and too much. For others, it's more the physical tasks that are too much. So I love these graphs because I think they're a nice concrete way of looking at, what is the current activity pattern? When we see people come into our clinic, they're usually in these high peaks and valleys of activity where they're just pushing through all these symptoms till they crash and essentially their brain stops them. What we want to do is get people to a place where they're working, maybe sub-symptoms, but not working as high into symptoms, and kind of taking rests and breaks in between. And so turning a timer on is a simple way to do that, to work for a bit on something and then take a break, and work on something and then take a break. And hopefully over time being able to increase that. When I think about students, they need to work for long periods of time studying, and they have to work up to that. But I think the pacing graphs, if people are familiar, I saw a few nods that people know about these, and I did include them in the chat. So I like the idea of that for visualization for patients.
Thank you, Penny. Really appreciate that. And may I actually just ask another question about the Brain X90? And I was wondering, just for the interest of time, if you wouldn't mind just answering that in the Q&A for her, and to talk a little bit more about that as I move on to the next question, which I believe is geared more for a bit of clarity for Dr. Guillemette and Dr. Lawrence, just asking what the objective diagnostic you use. So if you can touch a bit about that, I'm sure May and everyone else that's listening would really appreciate it.
Okay, I guess I'll answer that. So the the objective diagnostics that we use, we have 3 machines that are clinic in terms of if we're looking at actual numbers that we use quite heavily. The first one is called the video nystagmography. And essentially it's a device that kind of sits on your face and records your eye movements. Now, there's 4 main eye movements that we look at. So you have your ability to perform what's called smooth pursuit eye movements, which is tracking an object from side to side or up and down. You have saccadic eye movements, which is your eyes jumping from one target to the next. You have gaze stability, which is just holding fixation. You have vergence, which can be both convergence coming in, divergence going out. And then you have some optokinetic responses. Regardless, all of these different types of eye movements, we're able to measure them. And we're able to find out if you're properly tracking them, if your eye is kind of braking mechanisms when it's doing these tasks. Is your eye over jumping a target? Is it under jumping a target? How fast is it moving to this target? And dependent on either the speeds you perform these activities, the directions your eyes are moving in, different brain centers are required for you to perform these tasks well. So when we get the measurements of these, we're able to kind of analyze what part of the brain isn't working and figure that out from there. But the objective diagnostic is the tools that we use, which is the VNG, which is the video nystagmography, a machine that's called your saccodometer, which is looking at your eyes jump back and forth. And the last one is it's called the CAPS, which is a computerized assessment of postural systems. And that one's, it's a very precise balance platform that we're able to make patients do certain balance and stability positioning. And we're able to get some percentages related back to how well they can actually maintain their stability. So that kind of gives us a discrepancy or a way to differentiate between is the person's balance off due to vestibular issues? Is the person's balance off due to visual feedback problems? Or potentially is the person's balance not working due to proprioceptive feedback from the ground up? So that's kind of what those machines let us kind of diagnostically measure.
Awesome. Yeah, that was super in depth. And Dr. Lawrence, did you want to add to that? I don't know if there is more. That was really obviously well covered, but I'd wanted to pass it to you and get your thoughts as well.
Well, Dr. Guillemette pretty much covered it very, very well there. The key here is that we want to make sure we're always looking at comparing the information to age-matched controls that don't have a head trauma. So that's really, a key point further to Dr. Guillemette's point that, if we don't have the advantage of seeing an individual prior to their injury, which is most often the case, we're able to use this normative data to give a really good idea of how well or how far from the norm the individual may be at that time.
Thank you. Yeah, no, I really appreciate.
Now, if there's just one other thing I could just add really, really quickly. We talked about the pacing process, and I think it's really important. I just jump in real quick here. And of course, I have no disclosures here, but there's a company here in Ottawa called Neurovine, and I'm really excited about them. I have zero disclosures with this company, no involvement whatsoever. But what they do is they utilize a technology that's integrated with your cell phone, where they'll use an EEG headset as well as a heart rate monitor in order to use these metrics to quantify when you've reached your capacity for functioning. And I think this is going to be some really exciting technology in the future, because a lot of the times, again, no disrespect to anybody, we use these subjective guidelines, and this could be a little difficult at times for individuals, because some people may push through harder than others. But with this type of technology, there's no biasing done here. The individual own information will come and when you collect the the EEG findings and the heart rate findings. It'll give you what's known as a message to have a brain break. And again, this is something that's just sort of hitting the market now, and it's still in its testing phases right as we speak. And it's backed by a couple of PhDs who are working on this. And I think that's some of the shape of the future to come when it comes to helping to answer this really tricky pacing question people have.
Thanks, Dr. Lawrence. And yeah, we'll definitely be sure to add that link in the chat as well. I do see we have one more question. I believe two more questions, but I'll go to Tyler's because I think it is a fantastic question. One that I am very curious as well is, do you think there is a stigma to holistic treatments? And if so, how can I say we overcome them? Because I do think it probably does take a collective effort, but would love to get each of your perspectives. Jennifer, I'll pass it to you.
The short answer is yes. There continues to be stigma for sure. And I really have felt that around the creative arts therapies. With that said, I remember in the early 90s, it really was the beginning of the fMRI machine. And until that moment, we were working a lot on the evidence base, which is how we were determining that we were seeing these things. We were calling them intangibles, but they were also meaningful. And so we were measuring them as best as we could. As soon as the MRI machine came in and we noticed things, for example, with the arts, with music in particular, being a global brain process and things just firing up blue, we began to ask deeper questions. So the questions are, the quality of the question is going to lead us to the quality of the research that we keep doing. And the more functional we can make that research that actually is helping people, the larger the studies that we can incorporate, which takes more funding, the more we can collaborate, like we were saying before, so we can share this data across different sectors within the work. That's how I think we're going to overcome, because at its core, a lot of these holistic treatments, we know that the benefits are just so experienced on a day-to-day basis with so many people. Now, in order to reach the science world of the quantifiable data that people are looking for, we need to keep putting some new language around it, but connecting that into real research that is helping people transform their lives in the way they want to.
That's fantastic. Thank you. Thank you so much for sharing that perspective. I think it brings a lot more of an understanding, especially how far we've come, but still how far we have to go as well. So really appreciate that. Penny, is that your hand up from before or no? No
it was
worries.
my 2020 behavior of having my hand up when I did not have my hand up.
It's totally okay. Did anyone else? Oh, Dr. Guillemette, I'll give it to you.
Yeah, so I thought that was well said. I think it's really just keep putting everything out there in terms of what you're doing with your patients, what you're seeing for outcomes, and really trying to quantifiably assess it so that more people can see the successes you're having with whatever treatment styles that you're doing. I know we're already seeing a shift at our clinic where we have some pretty consistent medical providers give referrals, and it's basically just off of we provide the feedback from what's going on with their patients with certain reports. And once they kind of see that they're getting a certain amount of success with them, it basically it eliminates kind of a lot of the stigmas that are associated with whichever treatment you're deciding to do. So that's what I truly believe is just kind of keep doing your best and keep putting as much out into the world in terms of the successes you're getting, so that more people can build on it and it can basically grow from there.
Yeah, I mean, we can only do our best, right? That's I think something that's important for all of us, especially as we're going through this, as Krystal mentioned, a scribble type of journey of recovery. It really is, managing our best and accepting where we are. So thank you, Dr. Guillemette. And Krystal, I also know that your hand is up, so please chime in here.
I do think there is a stigma around the word, which is too bad. And sometimes I wonder if we could also contribute to sort of redefining the word. I know in my profession, the word diet has become a completely different thing than what we see it as. People hear the word diet and it means restrictive, it means weight loss, it means, diet culture. Whereas for us, it's like, it's just what a person eats from day to day. So, when I think of the first time I heard the word holistic and, I looked it up, I was like, oh, it just means looking at a person as a whole. What a concept. And so sometimes I think kind of bringing it back to that, holistic just really means considering how, the therapy we do, it does intersect and interact with so many different aspects of a person's life. And just to yes, and Jennifer's comment about needing research and needing to be able to show that objectivity. I think sometimes too, at least in my field, I see that the objective research that's done, kind of the low-hanging fruit, is to research just supplements and diets. Meanwhile, there's this whole trauma that is happening around food. There are challenges that people are dealing with food that's affecting their quality of life, and that's a bit trickier to measure. So expanding research to be able to measure those trickier things as well is what I would love to see in kind of my field.
Yeah, I definitely echo that. I think there is a lot more need, especially within, I think one of the reasons we are so excited about this panel is because there's not enough that we talk about when it comes to, nutrition, music therapy, speech language pathology, and even the neurology that comes from it. There's still so much that people don't understand. And, I think it's just a testament of how difficult this recovery is from this journey, and something that May, one of the attendees, had mentioned to us in the chat, is that it took her 3 years to finally understand pacing. And that's such a huge thing that has been mentioned, throughout all of this discussion. So it goes to show just how, complex this injury is. I mean, when we're talking about our brains, there is no system like it, on this planet. And I think it's hard for us to remember that it is a system. It operates all of us in our whole daily livelihood. So we have to find different modalities and different ways to treat it, because what works for one person may not work for the other, but we have to kind of put ourselves out there. And Penny, you want to add to that?
Yeah, I always think we have to remind ourselves we are a mind and a body and a spirit. And we sometimes get very focused on the physicality of things. And I think it's really important to remember in any health journey, which concussion is one, that the mind and the body and the spirit are all the parts of that make it holistic. I think sometimes problems arise when there's what is covered under OHIP and covered and not fee for service, and that becomes sort of a sticky wicket as someone who is sort of central and not sort of struggling as much, even though I'm a very small discipline. I can see that we need to move the needle to get to mind, body, spirit in treating our patients. I can think about examples of acupuncture where, years ago, I won't name professions, but certain people wouldn't touch acupuncture. And now it's very widespread use. And I think the evidence-based practices is where we need to focus and get some of these treatments studied and studied under RCTs and randomized control trials. So, Yeah, so we'll get there, but it is mind, body, spirit.
Absolutely. That's something that at HeadsupCAN we really believe in and try to encompass with all of our, efforts, especially through, social media, as that is obviously a great way nowadays to get that information out there. And Dr. Lawrence, did you want to add something? I think I saw, I don't know, I know you're obviously
Yeah.
very busy, right? But I just wanted to kind of put it out there for you.
No, all the points are excellent. I think you or one should consider there's, always an inherent issue with the issue of the stigma around the term holistic, is because there's going to be a certain amount of bias in the field of other types of individuals, practitioners, maybe, I don't know, that it's going to be really kind of impossible to change individuals' minds about what a holistic approach would be. They may have some certain preconceived notions. And I think that's a small percentage of the population, quite honestly. But I guess I'm saying this because I don't want anybody out there to, bang their head against the wall and feel that they're being, downtrodden, that their approach isn't something that people should be more aware of or should embrace fully. Because that you're not ever going to, satisfy all the people all the time. And, in my experience, I've run across that. Even though I drop thousands of papers on individuals and have great results, it just, doesn't really work that way. So, it's really important just to do your best and communicate outside of your silo. That's a key element. And, so many times we've run into, practitioners in our area that never had a clue what we did. And once they found out, then, working, synergistically with the patient just gives the best outcome. So, that's just, my 2 cents on the point there.
Yeah, we really appreciate it. And I think even metaphorically, we don't want people to bang their heads on the wall, as there are different ways. And there, as we can hear through this entire discussion, there are so many different approaches that we can constantly add. And I think that's the biggest thing, is we got to build our toolbox, and we have to take these holistic approaches and find these modalities, because there is no one-all cure-all unless, you're very fortunate. But for the most cases, as we've heard throughout this entire webinar, we need to find different strategies and incorporate them. And all we can do is try. And here are so many, experts who have provided such incredible insight into ways that you can add that to your repertoire. And we're so grateful to have each and every one of you here to round out our final CANTALK of this year. Hopefully 2022 will bring a lot more positivity and health, and we can do this maybe in person, as well. That's, big hope there. But just again, super grateful for each and every one of you. Our team at HeadsupCAN, I'm so thankful for everyone there who's helped put this together. Logan, you've killed it this entire duration that we put it together. Same with Ryan. Our 2 sponsors, we had Sokoloff Personal Injury Law and the Ontario Brain Institute, and this wouldn't be possible without either of them. So I know I'm kind of just filled with gratitude right now. Ryan, I'm sure you wanted to chime in as well here.
Yeah, no, just pretty much echoing the same sentiments you just shared, Seth. So yeah, really appreciate each and every one of the speakers. I think you all brought tremendous amounts of value and talked exactly about what we were trying to accomplish today, and talk about the holistic approaches and the various things that you can be doing if you're struggling through a concussion recovery. So yeah, thank you to everybody. And yeah, thank you to Logan. Thank you to Seth. Thank you for everything. And yeah, lots of gratitude going on here. I was already writing in my gratitude journal earlier today. So really appreciate everybody.
Thank you all. And for those that are here, you can find all of these speakers on LinkedIn, and I'm sure they'll be willing to answer any questions that you might have as well. And yeah, we hope you all enjoy the rest of your Tuesday night.